even if you're outside. But beginning today, gathering with a group of friends in a park, going for a picnic, as long as you are vaccinated and outdoors, you can do it without a mask. The CDC is able to make this announcement because our scientists are convinced by the data that the odds of getting or giving the virus to others is very, very low if you're both been fully vaccinated and out in the open air. The CDC also helped clarify which outdoor activities are safer or less safe, depending on whether you've been vaccinated. The bottom line.
My name is Nirav Shah, and I'm the director of Maine's Center for Disease Control and Prevention. And I'm joined this afternoon by Commissioner Jean Lambrou from Maine's Department of Health and Human Services. Commissioner Lambrou and I are pleased to be with you today to talk about where we are with respect to COVID-19 for today, April 27th, 2021. I'll begin with the public health update and then turn things over to Commissioner Lambrou for an update on testing. I begin my update on a sad note today. Maine CDC has received reports of 5 individuals who have died with COVID-19. 3 were women and 2 were men. 2 were residents of Androscoggin County, and 1 each was a resident of Cumberland, Oxford, and Piscataquis counties. 1 was in their 50s, 1 in their 70s, and 3 in their 80s. Their passings bring Maine's total number of deaths associated with COVID-19 to now 777. We'd like to take a moment to offer our deepest condolences to the family members, friends, and communities of all 777 individuals who have passed away. Overall, right now in Maine, there are a total of 60,430 cases of COVID-19 that have been diagnosed, an increase of 425 cases since yesterday. Of the cases reported today, of those 425, 162 received their diagnosis yesterday on April 26th. 250 were among individuals from April 25th, and the remainder, 13, were from individuals who received their diagnosis on April 24th. Cumulatively, 1,829 people have been hospitalized with COVID-19, and right now in the state, 119 people are in the hospital with COVID. 49 of them are in an intensive care unit bed, and 14 of them are on a ventilator. In terms of our positivity rate as a state, for PCR tests over the past week, that number now stands at 2.56% for our positivity rate. That number has come down. 1 week ago, it stood at 3.1%. And it comes at a time when our testing volume has stayed steady. Right now, our testing volume is at 706 PCR tests that are being conducted for every 100,000 people in Maine. Turning now to vaccines and vaccinations. Overall, Maine has administered 1,097,807 doses of COVID-19 vaccine. 613,854 of those are first doses. 483,953 of those are final doses. To put those numbers in perspective, among Maine people who are eligible for a COVID-19 shot, that is to say those who are 16 and over, 54.5% of them have gotten at least 1 dose, and 43% of eligible Maine people have gotten the shots they need, either both doses of Pfizer or Moderna, or their single shot of J&J vaccine. Speaking of the J&J vaccine, I'd like to take a moment to talk about our efforts underway in partnership with a number of different groups: Maine Emergency Management, FEMA, York County Emergency Management, to operate a pop-up mobile vaccination clinic right now in Biddeford at the Biddeford High School gym. That clinic has been operating there since Saturday and has been offering the Johnson & Johnson vaccine. The clinic is open today for about 2.5 more hours and will be open tomorrow from 8:30 to 4:30 p.m. Again, they will be offering the Johnson & Johnson vaccine. Walk-in appointments are available and encouraged at this site at the Biddeford High School. Again, they will be offering the J&J vaccine, and walk-in appointments for today, for the remainder of the day, and tomorrow are available and encouraged. Come Thursday, the unit will be taken down and will be moving its operations to Freiburg, to the Freiburg Fairgrounds, where they will start operations on Friday. Similar to what we've been doing in Biddeford and Windham before that, there will be a mixture of scheduled appointments, but walk-in appointments in Freiburg will similarly be available and will be encouraged. I recommend that everybody who's looking for a vaccine, if going to Biddeford is an option for you for the remainder of today or tomorrow, please take advantage of that. Similarly, for folks over in the Freiburg area, if you are waiting for or looking for a vaccine, particularly the Johnson & Johnson one, that option will be available at the fairgrounds later this week and through into early next week. And finally, one other update before I turn things over to Commissioner Lambrew around travel and travel policy. As we've talked about, come May 1st, there will be changes to Maine's travel policy, either for Maine people who have gone to another state and are now coming back to Maine, or for travelers arriving from those states. Effective May 1st, Maine people or travelers from other states no longer need to test or quarantine before coming into Maine. Now, this may change based on the possibility that certain states may have very high levels of variants that are causing increases in their case levels. We review those data here at the Maine CDC from time to time, and as of right now, there are no states that are on that exceptions list because of a high prevalence of variants, but that may change as we get further into the summer. But as of right now, starting May 1st, Maine people who are returning from travel to other states or travelers from those states will not need to quarantine or test upon their arrival here in Maine. This is in recognition of a couple of things. The first is a successful travel season last summer, where although we had a number of travelers coming in, very little transmission associated with that. But second, and just as critical, an increasing number of people around the country who are being vaccinated. Vaccination rates are increasing, and with that, the likelihood that any one individual may pose a risk to someone here in Maine goes down commensurately. So with that, I'd like to turn things over to Commissioner Lambrew now.
Thank you, Director Shaw. Today, the Mills administration announced that it will partner with Ginkgo Bioworks to offer a new COVID-19 testing option to Maine schools. Starting in May, the Maine Department of Health and Human Services and the Department of Education will offer any pre-K to 12 school the option to provide free, weekly, pooled PCR testing for COVID-19. Pooled testing involves collecting swabs from small groups of consenting students and staff, such as from one classroom, combining the test samples in a batch or a pool, and then testing the single pooled sample. If the pool results are positive, the individuals in that pool will be retested using a rapid Binax Now test or a PCR test. The positive individuals would then be sent home to begin their isolation period to limit the number of additional people infected and close contacts could be identified. Ginkgo's pooled testing program provides all the training and testing materials necessary, as well as the staffing, lab, and data processing services. The program is used by hundreds of schools across the country, and in Maine, the testing will be an option for the remainder of this school year, the summer programming, as well as the 2021 and 2022 school year. Testing for COVID-19 remains a critical tool in identifying infected individuals early, often before symptoms appear, and limiting outbreaks. Pooled testing joins the strategies already part of Maine's framework for reopening schools and returning to in-person learning. Schools have also used symptom screening, physical distancing, and facility improvements, among other public health practices, to enable in-person learning. We thank our school leadership, staff, and teachers for their hard work this past year to safely open Maine schools and hope that this new option helps them to continue that work. With that, I'll turn it back over to you, Director Shaw, for questions.
Great, thank you, Commissioner. We've got a good list today, so I'm going to start it off, and the first question goes to Brian Sullivan.
Thank you, Dr. Shaw. Just saw this release from the Mills administration following suit with the US CDC about the outdoor mask mandate. Could you just talk us through a little bit about what happened behind the scenes leading up to this and how you feel about it?
Sure, I can start. But Commissioner Lambrew and I have had numerous discussions about this. There have been a few things at play, Brian. The first is recognition of the evolving science. The continued recognition by scientific studies of the relative safety of outdoor activities as compared to indoor activities. Going back earlier in the pandemic, initial studies suggested that outdoor activities are 19 times, maybe even more than that, safer than indoor activities. And that finding has been corroborated by other studies. But on top of that, what's really changed in recent days, weeks, is the ever-increasing number of Maine people who have been vaccinated. Similar to what I was referring to in discussions around policy. When you combine that with better weather and wanting to have people have the same activities outdoors versus indoors, when you add on top of that the fact that more people are vaccinated now, that means there are fewer people that are out there who are susceptible. When you combine a safer activity, being outdoors, with more people vaccinated and thus fewer people susceptible, you've got an opportunity to encourage folks to be outdoors, to take advantage of being outdoors and not needing to wear masks. There's really not much more than that going on. It's just a recognition that times are changing because of vaccination, and with it, our policies are changing.
And we will be updating our executive orders, our guidance, our checklist documents in the coming days to reflect this change. But as Director Shaw said, that is why we are continuing our vaccination effort. The more we vaccinate Maine people, the more ability we have to begin to alter the public health protocols because the risk of transmission of COVID-19 is lower. So we do remind people that the sooner you get your shot, the sooner we can begin to move towards those sorts of activities, engagements that we all loved before COVID-19.
And I know you mentioned you're going to put out some more guidelines, but just explain to me what this means. If I'm walking down the street and I pass someone, am I throwing a mask on? If I'm at a restaurant, sitting outside, things. Who does this apply to? I guess it would be the question where social distancing isn't possible.
Yeah, let me begin with a just simple statement: is when you're outside in public settings, you are not required to wear a mask. We do recommend, though, if you are within 6 feet of other people, if you're in a crowded area, if you're at a concert, common sense should apply. We really do recognize the fact that while, again, as Director Shaw said, the evidence plus increased vaccination has led to this change, it still makes sense to try to protect yourself and protect others when you're in close quarters.
That's exactly right, Brian. We're asking folks to be sensible. Maine people have been sensible throughout the pandemic. That doesn't change today. If you're walking down the street and there's no one around you, there's no reason to wear a mask. We're safer now than we were a year ago. But if you happen to bump into a group of folks and you're chatting with them, throwing on a mask is easy to do. It's the respectful thing to do too. But in terms of other activities that you mentioned, like dining outdoors, again, outdoor activities, that much safer. So all the more reason to be outside and try to move a lot of the activities that a lot of us have planned from an indoor setting to an outdoor one.
Thank you.
Let me turn it over to Joe Lawler next.
Yes, hi, thanks. So just continuing on the outdoor mask questioning. Your changes go farther than the US CDC did today. And I'm just wondering if you could kind of compare and contrast and why you decided to go take a step farther than the US CDC.
Joe, when you say go further, could you just, so I answer your question properly, what are you thinking of?
Well, the US CDC said, and I realize the way the country is structured, the US CDC has always been recommendations versus requirements. But the US CDC recommended that people resume outdoor activities without masks who are fully vaccinated, and there's no such distinction with the Maine CDC.
Yeah, I can start, and Commissioner Lambert and I have had numerous discussions about this. One of the things that I think is important in Maine is that our vaccination rates are among the top in the country, and that makes a difference. Any policy when it comes to COVID partly has to contemplate what the policy will do, how effective will the strategy be, but it also has to take into account the underlying risk or susceptibility in the population we're talking about. And Maine is thankfully really well situated there. We are leading the league tables in terms of the percentage of our population that have been fully vaccinated. That means that we can do things like be outside without masks on with lower risk as compared to other states whose vaccination rates may not be what Maine's are. It's a testament to how great of a job folks have been across the state in getting vaccinated.
And we did consider, as we were looking at the US CDC recommendations, the term simplicity. We recognize that in the real world, when we're all trying to figure out what to do in certain circumstances, we tried different sort of nuances of masking policy here in Maine last year and ended up having more simple, bold rules. So there was not the kind of ambiguity about, well, I'm outside a store, there's a line, there's no 6 feet distance, what should I do? We want to make it pretty clear about what to do and when, with again an overlay of common sense that if you are outdoors and you are in a situation where it's hard to keep apart from other people, irrespective of whether you're vaccinated or not, it is the respectful thing, as Dr. Shaw said, to wear a mask, and it will also help prevent those very rare breakthrough cases or other types of transmission. You never know who around you may not be vaccinated or who may be immunocompromised. So we do take the recommendations seriously, but also wanted to create a fairly simple and straightforward set of rules for businesses, for other actors in Maine to follow.
Okay, thank you. Couple other little things. Will this have an impact on high school sports? I'm thinking, some sports already have spring sports have physical distancing in them, such as baseball, softball, maybe some track events. And then also a final thing, are you concerned about softening demand for vaccination?
I'll take the first part, which is we will be updating all of the COVID-19 prevention checklists, and that does include the community sports checklist to reflect this guidance. So that does include, for example, road races and other outdoor sports. Typically, the Maine Principals Association works in parallel with the community sports guidance. So I would expect that they would be looking at this adjusted guidance, but I would refer you to the Maine Principals Association about high school sports.
Joe, on vaccine demand, with the J&J pause, there was a decrease in the amount of vaccines that were being administered in the state. But with the resumption of the J&J vaccine starting on Saturday, our numbers of daily vaccines administered have started ticking back upward. That being said, we don't want to slow anything down. So we're starting, as you're aware, Joe, we're starting to shift to make vaccinating the easy choice. As I've, the way I think about this is that vaccination moves at the speed of trust. It also moves at the speed of convenience. So in order to try to get ahead of any slowdown in demand, we're trying to do things like making more vaccination sites have walk-in hours, trying to work with vaccination sites to offer hours of operation that work for working people, early morning, later in the afternoon. We're resuming things like homebound vaccination efforts with the lifting of the pause. So although we're aware that that's a concern that's out there in other states, we're going to try to change our system rather than just say, well, I guess demand is softening, nothing we can do about it. That's not going to work for us. Let me turn it over to Mal Meyer next.
All right, thanks, Dr. Shaw. My question is, outdoor gathering capacity can increase to 100% starting on May 24th. Will you make any changes to that timeline based on the new guidance released today?
At this time, Mel, we don't have any plans or any intention to.
Uh, is there a reason for that? Why you wouldn't move up that timeline then?
Well, we're still seeing fairly high rates of cases here in Maine. Again, 425 cases today. Again, we're always evaluating, but at this time, no plans right now.
And I'll add that as a reminder, our guidance is a set of layers, like a net on top of each other. And part of the other elements of our protocols include some of that distancing that does enable gatherings to happen. So at this time, we have not changed our physical distancing policy. We do continue to review it and gathering limits and all of our other guidance frequently. But at this time, given what US CDC announced earlier today, they looked at the science on outdoor transmission. We looked at the science on outdoor transmission. And we do think, again, in circumstances where we can maintain some of that distance, this seems like the right next step to go and, to take, but we are not yet to the point where we are making other changes to our protocols.
And then my second question for maybe for Dr. Shaw, you mentioned the studies that were conducted about outdoor transmission before. The US CDC guidance was just that, guidance, and many states before this announcement dropped a state mandate. Why wait for today's announcement when studies were already showing a low risk of transmission outside?
Sure. Well, now, what the moves that other states have made have been about mask mandates, both indoor and outdoor. Our indoor mask guidance is not changing. And that is because generally of the science that shows outdoor gatherings are significantly safer for a number of different reasons, either because there's more ventilation, which disperses the virus. There may be an effect because of UV light, things of that nature. In terms of why today in particular, well, the US CDC has finished its analysis. It comports with the analysis that we've been doing. So why wait another day?
Thank you.
Let me turn it over to Bonnie next.
Thank you, Dr. Shaw. Yesterday, we heard from a reader who's a resident of a nursing home in Androscoggin County. The gentleman is pretty frustrated. There's an outbreak there. The outbreak was discovered after a worker tested positive. He complains that, I've been vaccinated, but now I'm restricted from going out, save my family. Why aren't our nursing home workers required to get vaccinated?
Sorry, Bonnie, your question is why are nursing home workers not required to be vaccinated?
Correct.
Yep. I mean, there's a lot, a lot going on there. Of course, we've only just had the vaccines for a short period of time. And right now, the focus has been on creating incentives for folks to get vaccinated, making sure they know why it's an important thing to do, the ways in which it can keep them and those whom they care for safe. There are, of course, discussions that will be had as a state, as a nation, around mandating any kind of COVID vaccine for any group, whether it's healthcare workers, others. Right now, I don't know that's where the discussion is. Right now, our focus is on creating incentives, making the case for vaccines. I'm not foreclosing any other discussions, but right now we're just trying to get vaccines and make the case. There are concerns out there that some have expressed around, if vaccines not fully vetted by the FDA, things of that nature. So we're going to see where that discussion goes.
Is it now illegal to mandate that any worker get a vaccine in order for employment?
I think the Attorney General's office would probably have a better sense of that.
Yeah,
Okay.
and
And
I
any
will just
such-
answer that question. I think the answer is it is not illegal in the state of Maine for certain private sector actors to do that kind of requirement. We've seen some higher education organizations say that that is a prerequisite for students coming back, although many of those circumstances say it's a prerequisite to be living on campus or to be engaging in certain ways. So I think the field, as Director Shaw said, will be evolving in terms of what are those layers of protection allowed. I will go back to nursing facilities for 1 second and say, we do continue our very aggressive efforts to make sure that people who are new staff at nursing facilities, new residents at nursing facilities, do have the opportunity to get vaccinated, because we again think most of this is less about people not wanting to get vaccinated than not necessarily having a timely opportunity. So we continue to put that right in front of people to make sure that that is an easy as well as a accessible choice.
Thank you, Commissioner. Thank you, Dr. Shaw.
Thanks, Bonnie. Over to Amy Brown next.
Thank you, Dr. Shaw and Commissioner Lambrew. My question's in keeping with what we've been discussing. A listener got in touch with us who said that they work in a workplace, indoor workplace, where everyone's been fully vaccinated, but the DECD checklists and guidelines are still saying, everybody has to wear a mask all the time, maintain social distance. So they're wondering if those will be updated at some point, and if also we've had people ask about whether or not mixed workplaces with some people who are vaccinated and some people who are not, if those will always have to remain kind of in the pattern they're in right now. And yeah, so I'll just leave that there. I don't know which of you would like to jump in with that. Maybe it's more Commissioner Lambrew.
Yeah, I'll just begin with a relatively short response, which is we know that there are some areas, some different actors who recommend two sets of policies, one for people who are vaccinated, one for people who are not. I think here to date, we have been all in. We try to protect all Maine residents equally and have been trying to have a fairly simplistic set of guidance that evolves like it did today. When we find that the preponderance of evidence, the progress on vaccination allows us to modify one of our public health protocols, we will take that step and we will do it quickly like we did today. So our approach to date has been to try to set a fairly straightforward set of guidance for the state of Maine. And our hope is sooner than later, again, this is all on us. If we can get our rate of vaccination high enough for the population as a whole, a lot more of these guidance documents can change.
For a workplace where everyone is fully vaccinated at this point, though, assuming they're not having any interactions with the general public, just from an epidemiological standpoint, are they fairly safe if they all take off their masks? It would seem if the vaccines are really 90, 95% effective, that would be a relatively safe little pod to be in.
So I want to separate out the hypothetical from the real world. We are not in a nation that's, at this moment in time, certainly not in a state that has the ability to track, enforce, ensure, make sure that the protocols are adjusted and readjusted, because we're learning about this pandemic, every week as there's a breakthrough case here or some other challenge there. So, in the hypothetical, I can imagine that being a rational way to approach a workplace. But in the real world setting, having that kind of policy be able to be implemented, enforced consistently without there being, do I know if that worker over there is vaccinated, or what about a new worker, or what about somebody who went and traveled to one of those places that we don't have on our list right now, but that might have a high rate of variants of concern that comes back to that workplace, and maybe again, like our vaccines work well, but they're not 100% effective. So there's a lot of real world circumstances that have made our ability to do that kind of specific guidance operational. But Dr. Shaw, I don't know if you have anything to add to that.
No, I think that's exactly right. I mean, it's one thing to have a couple of friends over who are fully vaccinated in a private residence where for sure and you can ask. But in a workplace, those things are not so easy. You may not want to ask. You may not be allowed to ask. Not everyone may want to share. And so workplaces are different. You also have the element that people come in and out of workplaces, not all, but some. So I think for right now, Amy, we're not moving out or changing anything on things like workplaces, particularly those that are indoors.
Okay, great.
Mhm.
And today, Dr. Fauci talked a bit about some of the newer variants that have been added to the list. I believe there's a Texas variant now, one emerging from Texas, one from India, along with maybe California. Can you say a little bit about where we stand with variants and whether any of these newer ones have been detected in Maine?
Well, there are always variants that are being detected across the globe. Some of the ones that you noted in particular, like the variant that's been detected in India. There's others that have popped up in the United States, from New York, Texas, California. We have found instances of the so-called New York variant here in Maine, as well as a few instances of the California or Santa Monica variant that was first categorized back in December. But we haven't detected any other new strains as of right now.
Okay, great. Thank you.
Thanks. Let me turn it over to Dustin at NBC.
Sorry, I'm working by myself, so I'm jumping around today. Two questions. First, when you discussed some other guidance being updated following this announcement about masks, does that pertain to outdoor settings like restaurants where as you're being seated, if you're fully outside, you don't have to be wearing a mask or something like that?
Yes, we have, again, lots of checklists. There's ones for, seated dining. There's ones for outdoor gatherings. We do have significant guidance, and we'll be going through this systematically to make sure it makes sense with, again, a caveat. We do maintain the recommendation that when things are close, people should wear it. And again, the requirement to wear a face covering indoors maintains.
And my second question is there data on vaccine breakthrough that is being used to make some of these decisions? Is that something that you're looking at? And if so, what is that data?
Sure. So, Dustin, we track where possible cases of vaccine breakthrough. That is to say, someone who has been diagnosed with COVID-19 at least 14 days after completing their vaccine series. Right now, as of this moment, there are 107 such cases in Maine. To flip that around, what that means is that about 99.98% of people who have been vaccinated in Maine have not gotten COVID. A very, very small fraction have. We're keeping tabs on that, particularly when we see those cases arise in congregate settings, for example. So we are keeping tabs on that. Maine's numbers or percentages of breakthroughs are in line with those in the rest of the population. So when we think about things like outdoor masking, we're keeping that number in the back of our head by all means, but thankfully it remains the vanishingly small percentage of all the people who have been vaccinated.
Perfect, thanks.
Mm-hmm. Over to Chris Costa next.
Hi, Dr. Shaw and Commissioner Lambert. Can you hear me okay?
Yeah, sure can, Chris.
Okay. Got some new headphones. I'm trying a new microphone. Just a quick point of clarification. I know that several people have asked about this now, but as far as like the outdoor gathering limits, are those tied at all to the guidance that's on the DECD website right now about, you've got to wear a face mask? Like we had the 100% change coming from May 24th, correct? Is that based on people still wearing masks outside? Will that change at all?
Let me try to say, I think what you were saying a different way, that
Yeah.
what we're doing today is changing one element of our public health guidance, which is in the executive order that requires people to wear face masks in public settings. We're removing the part about outdoor settings, keeping the one about indoor settings, but taking out the one about outdoor settings. We're not changing the phase up of our gathering limits. We'll still go to 100% of the outdoor gathering limit on May 24th, 75% of the indoor gathering limit on May 24th. And we are at this moment maintaining our checklist that says, for example, in restaurants, you do need to have your tables 6 feet apart. So the rest of those public health protocols are remaining intact. But going forward, if you're walking down a sidewalk and there are not a lot of other people around you, if you are sitting in an outdoor restaurant, if you're going to an outdoor ball game and you're sitting in the audience and you're trying to sit, keeping 6 feet apart from the next family, that's a setting where we think that the transmission of COVID-19 is very, very low. Your risk is very, very low. So you don't now need to wear a face covering, whereas previously you did.
Okay, understood. Did want to ask a little bit about the walk-in appointments. How important, Dr. Shaw and Commissioner Lambert, do you anticipate these walk-in style clinics becoming as far as vaccinating the remainder of Maine's population? And I guess as kind of a second part of that question, is the fact that we're now seeing more of these walk-in appointments, does that indicate that maybe the demand for a specific appointment has gone down?
I'm not sure about the latter point, Chris. It's a hypothesis, but I'm not 100% bought in on it. But let me start with the first part. Um, Earlier on, when the demand for folks who wanted to be vaccinated was extremely high, we didn't want to move to walk-ins because of the possibility of two things happening. One is just overcrowding at vaccination sites. And then the second is the possibility that people may have driven or walked a certain distance only to find that there was no vaccine available, neither of which inspires a lot of confidence. But now that many folks who were in that first category, those who are urgently seeking a vaccine, now that they've been vaccinated and have had a shot at getting a shot, we now have a possibility to move toward walk-ins because those constraints have been lifted. The other thing that's happening is that a lot of the folks in that first wave were those who had control over their schedule. They worked from home, they could set their hours, and they could predict where they would be 2 Tuesdays from now at 12:35 p.m. But that doesn't apply to everybody. A lot of folks who are working don't have that command and control over their day or over their schedule. For them, being able to swing by somewhere during their lunch break or before work or after work literally may mean the difference between getting vaccinated and not getting vaccinated. For that group, which is a lot of Maine people, walk-in hours are critical. And all of these changes have made this possible. We've been working with sites to expand walk-in hours. One site in particular that I'm really excited about is the Expo in Portland, situated downtown, very walkable for a lot of folks. They will begin walk-in appointments starting tomorrow.
And I would add that that's just one of several approaches that we're taking to, again, try to remove barriers, because our whole goal has been to try to make this as easy as possible. We're also working with clinics on different hours into the evening on weekends. We know that that has been a problem for some people. We're working on workplace clinics, on campus, college campus clinics, moving our clinics to places where the time it will take, the effort it will take will be lower. So we're in that new phase where I think, Dr. Shaw, you like to say we're going from urgency to convenience. We're trying to make this as convenient as possible for people to get vaccine doses, recognizing that between work, childcare, family caregiving responsibilities, there are other barriers. So walk-in hours are one of several different strategies that we're using in the month of May to really try to maintain our great progress in vaccinating Maine residents.
Great. And then just a final question for you here. We've kind of looked at some data about the groups that had become newly eligible for the vaccine starting on April 7th. And what we had noticed was it seems like the decade or age bracket of 40 to 49 appears to be leading in terms of the number of shots that age bracket has gotten since eligibility opened up on April 7th. One, your reaction to that, and I guess the second part of that is, do we need those other groups, especially the 20s, the 30s that we've talked about, the younger people mixing and so on and so forth? Do we need those numbers to increase more?
I'll start with the latter question. Yeah, which Chris, which I heard to be, do we also need to do more work to get the numbers of folks in their 20s and 30s up, as we've seen an increase in those in their 40s? The answer is yes. For large scale population level type immunity, to really bend that curve of COVID cases down, we need folks across the age spectrum to get vaccinated. And so it's not any one particular decade of folks, it's got to be across the entire population. As to the question you pose about why folks in their 40s moving at a different rate, I think everyone's probably got a different hypothesis. Commissioner Lambrou?
Well, mine is less about a hypothesis than a head start that many of these people got. I mean, when we looked at our healthcare workers who were eligible back in December, we look at our teachers in Maine, there's a lot of them that are in that age group. So there was a little bit of a jumpstart. Public safety workers also are disproportionately in that older workforce. So some of it is less about people's interest or inclination than the fact that we had childcare workers, for example, a lot of workers who were in those categories that were ahead of the other people under the age of 50. So when you go back and look at what our data were like before April 7th, we had some of that pattern happening then.
That is my hypothesis as well, just timing. Thanks, Chris. Over to Patrick Whittle next.
Thank you very much. I'm going to ask you to repeat something if you don't mind. Did I hear correctly that it's on May 1 that travel restrictions involving quarantine and testing are rescinded for both incoming and outgoing?
Well, yes, it's all incoming. That is to say, whether you are a Maine person who has gone to that other state coming into Maine for a visit. Either way, it's incoming, but yes, it's May 1st. It comes on top of what already exists, which is that same pattern for New England. Now it's just extended more broadly.
Got it. I think what I should have said was incoming and coming back.
Yes.
Okay. A trend that's emerged in the state of Maine and elsewhere is that the percentage of women who are getting immunized is higher than the percentage of men. And my inclination is to ask what our problem is, but there might be other explanations just besides what's our problem, and I'll hand that over to you.
Well, I'm going to go back to the same hypothesis that we noted a moment ago, which explains, I think, not only certain age differences, but also some of the gender-based differences. That is to say, women being well represented in fields like healthcare and education, who were offered earlier spots on the vaccine rollout as compared to non-frontline healthcare workers, for example. I think that was part of it. That I think explains some part of the difference there as well. Commissioner, if you've got other hypotheses, but that's what we've seen in the data, or at least what I've seen.
Commissioner Lambert, did you have anything you wanted to add to that?
No, I think we, again, do know our school professionals, our healthcare professionals are disproportionately women, and I think that might be it. We do know also in the field of health services that women tend to use healthcare more than men, generally pre-pandemic. That also could be a factor in vaccination.
Got it. All right, thank you very much. I appreciate it.
Great, thanks, Patrick. Over to Megan at WMTW next.
Thank you for taking my question. It's about this pool testing that schools can either opt in or I guess opt out of. Can you first primarily just kind of explain why this strategy works?
So it's really just a protective protocol. So let's pretend that we're in a school and we're going to do classroom testing on Monday. So kids go to school, they all get their swabs, they put it into kind of, again, one vial for a certain number of swabs. That classroom gets tested. We know the next day, basically, maybe 2 days later, but mostly the next day, if anybody in that classroom, teacher or child or staff, is positive, and if one of those people is testing positive, then immediately we test everybody individually to isolate the person who is in that classroom, who then needs to be home, take care of themselves, and who are those close contacts. It is a way to check every single week what's happening in a school, and do we need to, again, with asymptomatic people, isolate somebody.
So it's essentially large groups at once. You're able to cross them off if nobody tests positive.
Exactly right. That's exactly right. It's really sensitive, and it can pick up just one person in the classroom. And if everyone is negative in that pod, in that pool, then you're good to go, at least for that testing period.
And just briefly, I was reading the press release from the governor's office that kind of came out simultaneously to the announcement here. It says that that Ginkgo provides training, labs, and staff. Does that mean somebody in the school is trained, like a nurse, to do these tests, or is there like an outside person that Ginkgo provides?
It's going to be a mix of both. We are excited about the fact that there are some schools who are very eager to do this themselves. And in Massachusetts, what they did was they started off with this full service model, but then over time, the teachers, the staff, the school nurses got very facile with it, so it was easier for them to do it themselves. So we're going to meet schools where they are. We're going to work with them on how they want to set up this program, and we're cautiously optimistic that once they begin this, they can see how simple it is and how effective it is, and we'll not only continue this into the summer and fall, but convince other school districts to do it too.
Just lastly, I know this is a kind of a new announcement, but have any school districts opted in yet?
So just today, we're having our first webinar for our different school districts to explain what it is. We're not asking anybody to opt in until they know the details. We'll do a second one this week for those schools that might have missed today. And we are just hopeful that when we launch this program in mid-May, we have robust participation.
Thank you.
Thanks, Megan. Over to Caitlin Andrews next.
Hey, good afternoon, Dr. Shaw, Commissioner Lambrou. Sorry if I missed this already, but can we get an update on the number of variants that have been detected in the state so far?
Yep, I will pull that up in just a second. I'll have it for you in about 10 seconds, Caitlin, but if you've got another question, go ahead.
I do. On the May 1st travel change, I'm wondering what cutoff you'll be looking for when determining where people can travel to or from. Will you be watching other states like PCR testing, like the percentage that variants will be, and can you explain like what those benchmarks might be?
Sure thing. Let me start with where we are in terms of variants overall, and what those numbers are. I'm just going to do it by the variant. So of the P1 variant, we have detected a total of 10 of those. Of the 351 variant, we've detected 3. And of the 117 variant, we have detected 103.
Okay, thank you.
And then in terms of,
well, I was going to say on the travel policy, I do want to make one quick clarification before Director Shaw talks about kind of the factors that go into this. This is not a new policy. We announced this policy in early March in recognition of the fact that our old policy was assume that people need to test or quarantine and exempt people when they come from places with similar levels of transmission in Maine. We're now flipping it to the opposite, and we announced that change again over a month ago, and today we're just explaining who's not on the list, which is we say we're only going to require that quarantine and testing if an individual travels to or from one of these states where there could be a challenge. And Director Shaw, you want to talk about those challenging circumstances that we're looking for?
Sure. So let's going back to variants really quickly, Caitlin, and then we'll talk about how we think about it in terms of other states. Maine's got one of the more robust variant testing architectures in place. We are testing we're testing about 5.6%, maybe a touch higher now, of all of our positive samples. The CDC only recommends that you test 5% of your samples, but we're well above that. And when I checked about late last week, we were in the second or third highest spot in terms of percentages of variants that we are sequencing. That means we've got a good sense of what's happening here in terms of our sample size. When we look at other states, what we're looking at is, again, they're predominantly the percentage of all of their new cases that are being driven by variants of concern. Now, some states have had variants of concern that have played something of a role, but then they've also tailed off. So California, back in December, January, had a high number of cases being accounted for by a variant, but then it's tailed off. Similarly, in New York, the same thing as vaccination is rolled out there. We see this option of putting a state on the you now must test or quarantine list as sort of a in case of emergency break glass type of standard, which is to say a state that is experiencing uncontrolled spread of the virus driven predominantly by variants. Right now, thankfully, there's not really a state that meets that fairly strict criteria. If we find something of that nature, then we've got the ability to put them on the list.
Okay, but just to be clear, we don't have a number of like, say, 10% of new cases are being driven by variants. That's person's going to have to quarantine or, like a number like that.
No, I mean, similar to how we've done most of our policies, it's a mixture of quantitative analysis. So what's going on in a particular state, and these data are on various genomic tracking sites, what's going on in a particular state, as well as what's driving that, which is a qualitative determination. So it's a mixture of quantitative analysis as well as qualitative analysis.
Okay, and my last question is, it certainly seems like we're seeing some mixed concerning metrics for COVID. Hospitalizations are slowly creeping, nursing homes are seeing outbreaks again. vaccinations dropped off last week. Maybe that will change relatively soon. But the PCR is going down, which seems like kind of like a positive metric. Like what do you kind of make of all of these mixed things? And are we concerned that Maine's like progress, which has handled the virus better than like a lot of states and has seen high vaccination, could be stalled by those?
I'm not sure about the latter piece, but let me focus on the former. You're right. It seems like if you look to the left, you see something scary, and if you look to the right, you see blue skies. And it's those are not impossible to reconcile. Important to note is, and as you're well aware, Caitlin, some of these metrics are different snapshots of that same fast-moving train, but at different time periods. Hospitalizations really tell us what was happening 12 or 14 days ago. Deaths tell us what was happening 14 to 20 days ago. Positivity rate about 48 hours ago. So they all sort of go, but in sequence. I think the bottom line here is that these things are not in conflict with one another. The virus is spreading, particularly amongst younger groups. And thankfully, older individuals, even though we sadly had a number of deaths today, are generally now well protected. To your latter point, I don't think our progress around vaccination will stall. It dipped last week because of the pause of J&J. It has picked back up, thankfully, since Saturday. That's a good thing. The key for us is going to be vaccinating those groups, as we were mentioning with Chris, in their 20s, 30s, and 40s. That's where a lot of the spread is happening, and getting that group of folks offered vaccine in a way that's convenient to them, that's going to be the way we keep our progress up.
Thank you.
Over to Stephanie next. Stephanie Wittenbach next.
Hi, thank you. So I have two questions. First one is, so basically 60% of all of Maine's COVID-19 deaths have been in long-term care facilities such as nursing homes. I'm just wondering how much of the more than $1 billion in COVID-related funds that our state has received has been used to help and protect these nursing homes.
So I'm not exactly sure. Are you talking about the American Rescue Plan, $1 billion?
This is going to be the 278. Sorry, give me 1 second. I'm just looking at the data that I have here. Basically the general fund that we received.
God, well, maybe I'll pull back a little bit and talk about our work with nursing facilities since the start of the pandemic.
Mm-hmm.
You know, we know that they've been extra hard hit. And when we look at COVID-19, it's different than anything else we've seen hit. I mean, annually there's flu, and flu is a contagious disease. We don't see flu hit nursing facilities the way that COVID-19 hit them. So we have, in addition to financial support, which I'll talk about in a second, provided PPE to those facilities, supported them in testing. Many of them used our state lab in the middle of the pandemic to make sure that we were providing regular aggressive testing to keep residents and staff safe. We did temporary rate increases last year in Maine Care, and Maine Care is a main source of financing for those nursing facilities. We offered a special version of the Economic Recovery Grant Program that the Department of Economic and Community Development ran for healthcare industry, for nursing facilities, hospitals, and others that experience great losses. We do continue to see challenges in nursing facilities. We are working with the Maine Healthcare Association on what are the needs and what are the opportunities with the American Rescue Plan and other congressional bills that will be supporting the state. So we look forward to working with them on that. And there was some good news coming out of the Revenue Forecasting Committee today. We're grateful for the fiscal stewardship that the governor and the legislature have provided to the state of Maine, as well as the federal support. And as we roll out our plans for the American Rescue Plan, as well as the supplemental budget to finish out this budget year, we will be talking to nursing facilities and other healthcare organizations and other parts of the Maine economy to see how we can best match need with the resources that are coming our way.
Yeah. Is there some data that we can get to see how much money has been allocated to help the nursing facilities? Just because, I think so much money has been given elsewhere, right, to like education and the logging industry or other places where, I mean, it's been so prominent that or 60% of Maine's COVID-19 deaths have happened in the nursing homes, that I just feel that we would just like to have some data to just see how much help has gone to the nursing, I mean, to the facilities, right? You said that it went to, I think you said Medicare, but yeah, do you have anything like that?
Yeah, the federal government has provided a lot of money as well. There's a HHS website that does provide that, but we can get that to you.
Okay, thank you so much. And then one other thing, this morning, the Bangor Daily News reported that the nursing facilities are dealing with a dozen new outbreaks. How is the CDC confronting this issue right now?
Well, as Commissioner Lambrou noted, outbreaks in nursing homes have been, unfortunately, one of the findings that we've seen throughout the pandemic. Indeed, some of our very first outbreaks associated with COVID-19 were sadly in nursing homes, long-term care facilities, and other types of congregate settings. Our approach to nursing home outbreaks is one that we've thankfully had. We've had great partnership from our colleagues in the in the congregate care setting we're working on. We focus on a couple of things. The first is making sure when we find out there's an outbreak that we are working with them immediately on things like PPE. Do all the staff have PPE? Are they fit tested? And if they're not, what can we do to get them ready to use an N95? The second is around testing. Universal, frequent rounds of universal testing are key to getting a sense of what's going on in a facility, particularly in an outbreak. And the third, which is more advice driven, is around infection control. Fundamentally, any outbreak in a nursing home has to come in from somewhere. And so our team of infection control preventionists works with the nursing home themselves to do things like putting patients in cohorts so they're not spreading the virus around to uninfected people, checking in to make sure protocols around staff temperature checks and making sure staff are healthy before they come onto the shift, making sure all those protocols are abided. It's part of the help that we provide before an outbreak, for sure, to prevent, but then during an outbreak to try to tamp things down.
Just to put a finer point on that, the Maine CDC, our Maine Department of Health and Human Services, Division of Licensing, Certification, and Aging Services, working in partnership with our nursing facilities. While we know they've been disproportionately hard hit relative to other sectors, Maine has done relatively well. Our nursing home death rate, our nursing home infection rate has been lower than most other states, and that is a testament to the good hard work that everybody's done, especially in light of the fact that we are amongst the oldest states in the nation.
And the final question for the afternoon goes to Patty White.
Thanks, Dr. Shaw and Commissioner Lambrou. In terms of lifting the mask requirements outdoors, why aren't variants more of a concern, especially when they were thought to be a factor with the rising case numbers that we had recently?
Well, variants are a concern, Patty. There's not a question about that. Thankfully, we have not seen them predominate in Maine. That's, again, a testament to the good work that folks have done, as well as to our high rates of vaccination. The other element there, Patty, is that although variants are a concern, they are the outdoor conditions, be it wind and ventilation and sunlight and the things that make outdoor activities safer. They do just as great of a job lowering the risk of transmission driven by a variant as from a non-variant. And so again, although variants are a concern, we're sequencing, we're on the lookout for them. It doesn't really affect the calculus of whether outdoor events are safer. They most certainly are, even when you factor in account variants.
So the transmissibility it's more of an issue indoors.
Very much so. I mean, theoretically, something that's a lot more transmissible, a variant that's a lot more transmissible, remains more transmissible, but that increased infectivity or contagiousness is greatly outweighed by the conditions that make outdoor activities safer. Again, different scientists have different views on why outdoor is safer. They go into three general buckets. One is that people are just naturally more spaced out outdoors. The second is that there's wind and ventilation that just disperse the virus such that there's not enough virus in any one aerosol droplet to make anyone sick. And then the third is the possible effect of UV. So even a variant that may be a little bit more contagious, that effect is greatly diminished when you layer on top of that those outdoor conditions.
Okay, thanks. And then I wanted to ask you about demand and hesitancy. And I'm just wondering, when you see hospitals and other places stop offering vaccination clinics or mass vaccination sites that have more appointments available, what do you attribute that to? Is it a function of hesitancy or is it more about convenience and motivation?
There are, and I mentioned this last week, I think when we think about vaccines, there are different folks that they come to the vaccination discussion with different notions. One group has basically said, I'm going to get vaccinated no matter what, and I will go no matter where to get that shot. The second group, and the group I think I'm focused on right now, are those who are motivated by convenience factors. And then the next are those who have earnest questions. And there may be another group out there that just says, I'm not listening to anybody except my doctor. Understandable. And right now, based on conversations I've had and stories people have told me, convenience is driving a lot of it. They may not be able to go to the hospital in their town at the times that that hospital has a clinic open. They may not want that experience either. They may want something quicker, faster. And so I think that's kind of what we're seeing with some rural hospitals not offering as many vaccine slots, some of the larger scale sites having slots available. I don't know if that's hesitancy as much as it is convenience driven right now.
Okay, thank you.
I guess though the important point though, Patty, is how do I say this? We're not waiting around to find out, right? I mean, our approach is to say, okay, there are unfilled slots. Where can we move vaccine? How can we change the system to fill them back up? As we've discussed, we have a number of ways we're doing that. Walk-in appointments are critical. Extended hours are important, are very, very important. Bringing vaccine even closer to people, for example, in their doctor's office, making vaccine part of normal preventive care. Those are the approaches that you'll see us rolling out in this next phase.
And as part of that, I mean, do you think that the mass vaccination sites will have less of a role going forward? That it'll be sort of a shift in strategy?
I don't want to go that far quite yet. I do think they will continue to be, they continue to be busy. So I think they will continue to serve a purpose. What I guess the way I think about it, Patty, is it's not so much a can we turn those off or down. It's more of a what can we activate and change to complement them rather than turn off the mass vaccination sites.
Okay, thank you.
Mm-hmm. Very good. Well, thank you all for your time. Commissioner Wambrew, I will turn things back over to you to close us out for the afternoon.
Sure, thank you. So as we track our data, look at the trends and see what can change here in Maine, we will act as we did today with the US CDC confirming what we and our experts have concluded, that there can be less wearing of face masks outdoors when you're not near somebody. We still recommend it though. I just want to say that we always are trying to couple our policy with our public health. And while it's no longer a requirement that you wear a mask outdoors, we recommend it when you're in proximity to other people. Similarly, our testing policy will change on Saturday. We will no longer require that you test or quarantine if you're unvaccinated and travel to and from states outside of New England. All that said, we still do recommend that you get a test. We know a lot of people are coming back from April vacation. We hope that people have great, safe vacations. But right now, if you haven't gotten a vaccine, you're coming back from vacation, we do continue to require for the rest of this week, and then after May 1st, recommend testing. Testing is a great tool to find out if you are an asymptomatic carrier of COVID-19, and if so, for you to protect your family, your work colleagues, as well as your neighbors from COVID-19. So we do urge people to continue to follow these public health protocols, even when they're not required.
Great. Well, thank you all so much for your time this afternoon. We'll look forward to chatting with everyone again soon. In the meantime, please be kind and take care of one another. Talk to everyone later.